This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, May 26th, and I'm Zach Caruso. Our lead story this week is in the Journal of the American Heart Association and is titled Methamphetamine Use Among Adult Patients Presenting with Acute Coronary Syndrome, a single-center retrospective cohort study. This study included 1,300 patients treated for an acute myocardial infarction, or MI, at a California health system between 2012 and 2022. A total of 194 patients were methamphetamine users. The Meth-MI group had less diabetes than the No-Meth-MI group, but many more smokers. Nonobstructive coronary disease was more common in the Meth-MI group, which consequently had lower rates of revascularization, aspirin, and statin therapy. The Meth-MI group had double the mortality, and methamphetamine use was the strongest predictor of mortality, greater than diabetes. The Meth-MI group was more likely to have a subsequent MI. The risk of MI with methamphetamine use is 19% higher than the risk with cocaine use. The authors believe presentations with methamphetamine use and angina without MI is even more common. Next is an article in the American Journal of Psychiatry and is titled Low-Dose Buprenorphine Following Ketamine Treatment for Suicidal Ideation in Major Depressive Disorder, a randomized, double-blind, placebo-controlled trial. Ketamine rapidly reduces suicidal ideation, but its effects are often short-lived. This randomized clinical trial evaluated low-dose buprenorphine as a follow-on treatment after ketamine in adults with major depressive disorder. Buprenorphine was associated with greater and more durable reductions in suicidal ideation than placebo over a 4-week period, indicating a potential new treatment approach for suicide prevention. Our next article is in the Journal of Studies on Alcohol and Drugs and is titled Beyond Attendance, Social Anxiety and Psychiatric Concerns Predict Mutual Help Group Involvement in a U.S. National Longitudinal Survey. This study included 531 mutual help group or MHG attendees with alcohol use disorder surveyed at baseline and 6 and 12 months later concerning barriers to MHG involvement. MHGs included 12-step groups as well as second-wave MHGs, Women for Sobriety, Life-Ring Secular Recovery, and Smart Recovery. The most common barriers were related to social anxiety, such as, quote, I don't like crowds or large groups. Second most common barriers were dislike of meeting attendees and content, such as, quote, I didn't like hearing the same stories over and over. Least common barriers had to do with motivation or perceived need, for example, quote, I could change and do it myself. More barriers resulted in less MHG involvement at 6 and 12 months. All second-wave MHGs attendees reported fewer barriers, possibly because they self-selected these groups after attending 12-step MHGs. Social anxiety was the most common barrier, and the authors suggest MHGs offer smaller meetings and make efforts to welcome newcomers. Our next article is in Drug and Alcohol Dependence and is titled Care Trajectories Among People with Opioid Use Disorder After Release from New York City Jails, a State Sequence Analysis Approach. OUD is common among those incarcerated with an increased risk of overdose after release. Researchers conducted a retrospective cohort study to assess any association between MOUD receipt during incarceration and treatment trajectories for 1 year post-release from New York City jails. Researchers found 26% of incarcerated people with OUD received MOUD maintenance, while 41% received withdrawal management and 32% received no MOUD in the days prior to release. Researchers identified 8 treatment trajectories, including continuous MOUD, treatment discontinuation after 6 months, MOUD with reincarceration events, and others with little or no MOUD. In-jail MOUD was strongly associated with continuous MOUD post-release, and authors note these findings highlight the potential for in-jail MOUD to improve MOUD uptake and continuity in the community. Next is an article in the Substance Use and Addiction Journal and is titled How is Food Addiction Addressed at U.S. Substance Use Disorder Treatment Facilities? Perspectives of Service Providers. While food addiction, or FA, does not have established diagnostic criteria in the DSM-5, there is research to support FA as a behavioral addiction and that it may be like other SUDs. Researchers conducted cross-sectional survey interviews at SUD treatment facilities to assess how FA is addressed. Researchers found that most programs did not provide formal FA treatment. 29% did have within-facility FA treatment. The authors note programs often reported eating disorders were outside of treatment scope and thus did not address FA. The authors call for additional research in this area while highlighting the need for formal diagnostic criteria, clarification of overlaps and distinction between FA and eating disorders, and mechanisms for treatment reimbursement. Our next article is in Pediatrics and is titled Opioid-Related Medication Access for Adolescents Who Test Positive for Fentanyl. This retrospective cross-sectional study examined access to buprenorphine and naloxone for adolescents who tested positive for fentanyl during an emergency department visit in an academic children's hospital in Washington, D.C. Between November 2023 and February 2025, there were 84 ED encounters for adolescents with positive UDS results for fentanyl. 62 were positive for illicit fentanyl, and 23 patients were diagnosed with OUD. Of the ED visits, 34% resulted in inpatient admission. Inpatient admission was associated with significantly higher rates of buprenorphine initiation for patients diagnosed with OUD as compared to those who were only seen in the ED. Naloxone was prescribed in 34% of encounters and was associated with an opioid-related diagnosis. While small, the study highlights important trends including a need to increase naloxone awareness and prescribing for adolescents at risk for overdose, as well as a need for increased MOUD initiation in ED settings for adolescents with OUD. Next is an article in Addiction and is titled Characterizing Public Comments via Regulations.gov in Response to Proposed Cannabis Rescheduling in the United States. The objective of this mixed methods analysis is to characterize public comments submitted to regulations.gov regarding the DEA's cannabis rescheduling proposal and identifying underlying justifications for support or opposition. Using LLM-based classification validated against human annotations, the study found that among 42,000 comments, 28% supported rescheduling, 6% opposed, and 63% deemed the proposal insufficient, favoring further rescheduling or complete descheduling of cannabis. Among the 200 manually annotated comments, therapeutic benefits and economic impacts were the most common justifications among supporters. Public health risks, addictiveness concerns, and concerns about underage use were predominant in opposing comments. Insufficient rescheduling comments cited therapeutic benefits, economic impacts, and criminal justice reform as primary justifications. Our final article is in the Journal of Substance Use and Addiction Treatment and is titled, quote, "It was good because they have a relationship with us, a qualitative study on low-threshold buprenorphine treatment at syringe service programs." This is a qualitative study of 12 participants who received buprenorphine at an SSP as part of a parent randomized controlled trial of buprenorphine treatment at SSPs. Interviews focused on experiences with clinicians, experiences initiating buprenorphine, prior OUD treatment experiences, and perceptions of buprenorphine continuation. 4 main themes were identified. 1. On-site treatment facilitated buprenorphine initiation, but additional support was needed. 2. Precipitated withdrawal complicated initiation. 3. The SSPs were seen as welcoming and affirming. And 4. Strong relationships with providers were critical for buprenorphine initiation. The authors proposed a, quote, low-threshold, high-touch model as the ideal way to support patients through buprenorphine initiation, emphasizing the core principles of low-threshold care while also integrating peer support through the initiation process to check in on the patient. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.